Our expert panelists joining us today are Dr. Richard Palmquist, Integrative veterinarian and owner of Centinela Animal Hospital. He's an author, lecturer, and teacher. Dr. Christina Chambreau, internationally known homeopathic veterinarian, lecturer, and teacher. Joan Ranquet, animal communicator, teacher, author, lecturer, and owner of Communication with All Life University. And Brendan Golia, professional pet trainer, behavior expert, and owner of OC Canine Coaching. Welcome to Smart Pet Talk. I'm your host, Anna DeVere. In this special episode, we're excited to be joined by Dr. Ruth Roberts. After completing her veterinary training, Dr. Roberts delved into the realm of traditional Chinese veterinary medicine, acupuncture, Chinese herbal medicine, and food therapy. She was the visionary behind the original crock pet diet and has been a guiding light for thousands of dogs and cats on their path to wellness. To expand that impact, she created pet wellness courses, which offer a certified holistic pet health coaching program designed to empower pet guardians and professionals with in-depth tools and training that they can integrate into their pet care routines. This program covers holistic nutrition, herbal therapy, and lifestyle modifications that improve pets' health and wellness. Welcome, Dr. Roberts. Thank you for joining us today.
I am so delighted to be here, and just such a great group of people here. So excited to get started.
You included. Thank you. Dr. Palmquist, would you like to open up our questions today?
Oh, always. Allergies are such a common complaint that people have to deal with, not just with their pets, but with themselves and their family and their children. And typically we have this conversation about an allergy as a overreaction to something that's in the environment. Like we all know about peanuts. Somebody eats a peanut and then they decide to drop dead because their partner kissed them, or they accidentally walk by a candy bar with a peanut in the grocery store. And they don't make a lot of biological sense. But the thing that I'd sort of like to start out with before we just do the normal routine everybody does, this is an allergy, this is what they are, blah, 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 is actually, let's talk about steps a pet owner might be able to take to actually reduce the chances that their animals become hypersensitive or become allergic. And in your view, do you have any paths to health before we fight the disease? Like, what could we do to actually delay the time that we need to see you?
Yes, that's the ultimate goal, right? Is to stay out of the doctor's office. So I think there's a myriad of factors contributing to allergies. And amongst them are microbiome health, what the pet is eating, if they're eating a highly processed diet, if they are sitting on the sofa all day with very little exercise, if they have extreme stress or anxiety, and sadly, lastly, if they are spayed or neutered. There's a lot of research coming out showing that is a big factor in a lot of chronic disease, sadly.
And then environmental chemical exposure as well. If we poison them every day, they're more likely to go,
microplastics and glyphosate and heavy metals. I mean, we're just full to the brim. You can throw an EMF and everything else, all of the other things that we're worried about. But yeah, so if we can help the pet parents learn how to avoid those things in terms of making sure they have clean filtered water, that they're eating fresh food ideally, and then supporting the microbiome, whether that's with fermented foods, probiotics, and then if the pet is spayed and neutered, and this is kind of the double-edged sword of the spay neuter programs that have been so effective in controlling pet population, supporting that pet so that, again, microbiome is supported, liver detoxification is optimized, and we mitigate all of the other lifestyle factors that can impact the immune system going awry.
So are you speaking about spay and neuter in general or spay and neuter in adolescents? Does it matter?
It does seem to. So the younger that these guys are spayed and neutered, the longer they have to deal with this. So the research is coming from Dr. Michelle Kutzler from University of Oregon, Corvallis. And in dogs, what she has found is that The level of luteinizing hormone, which is a hormone that is supposed to help mature eggs, help mature sperm, is something like 20 to 30 times higher than an intact pet. And also, what appears to be happening is that this higher level of luteinizing hormone is inducing receptors for the hormone in tissues that shouldn't have them. So, this is a huge problem. And the other thing
Wait a
is
minute,
that, yes,
Dr. Ruth, can you make that,
yes.
can you restate that again a little more simply? The luteinizing hormone.
You mean
and
not
the
in doctor
tissues.
talk?
Yes,
Yes.
please.
Yes. So essentially, the way this works is that when you take the gonads, the ovaries and the testicles out of the body, this homeostatic mechanism has been removed. And so when that goes away, then all of a sudden we have a tremendously elevated amount of a particular hormone called luteinizing hormone that's supposed to be present in small amounts to help pets mature the eggs, mature the sperm, and have normal abilities to reproduce. But when they are spayed and neutered, that shutoff mechanism to tell the body, hey, we've got enough of this stuff running around here, is gone. And so those levels go high, and then other organs, other tissues develop receptors for these hormones that really shouldn't have them. And what's happening is the cells are doing things they shouldn't be doing. I think, we could talk about almost every chronic condition that we're dealing with today. And I think that we could say, well, sadly, there's too many LH receptors in that tissue.
It's almost like the gonads are there for something more than just making babies.
You think? It's like in women. So if you remove both of a woman's ovaries before she hits the age of 64, even if she's been in menopause for 10 years, you have just taken 4 years off of her life. So there's plenty of evidence in the human literature that this is an issue. And really, the research started coming out in 2013 with the first paper from UC Davis about golden retrievers. And what they found was that goldies that were intact, they had very little incidence of the really horrible cancers, the hemangiosarcomas, osteosarcomas. They had very low incidence of cranial cruciate rupture, so bone and joint disease was minimized dramatically. But in the animals that were already spayed or neutered, then the incidence of all those diseases came up considerably.
Yeah, so we traded off. We told people for years and years as veterinarians that if they spayed and neutered their dogs, that they wouldn't get prostate problems and they wouldn't get breast cancer. We traded that off for bone cancer and splenic cancer, which are actually more difficult to treat. So there are big penalties to violating the integrity of the body. They just don't show up right away sometimes.
Agreed. And that sometimes they do. I mean, I think as for all of us as veterinarians, we've all had the tragic puppy that develops lymphoma or some other horrible cancer at 6 months of age.
But I think we also, in doing it, have compromised our responsibility as pet parents, because, we can go to the dog park anytime. We're not thinking about what the cycle, a monthly cycle for an animal is, and therefore we don't have to really tune into all of that.
That is a really interesting point. I mean, that's kind of part of what I think ends up contributing to behavioral issues as well, which is sort of a whole nother league. But if we're checked out and we're not present with ourselves and with our pets, then that leads to all sorts of issues. So that's a marvelous point, Joan.
However, I do want to add in that more and more, even in the conventional area, we can do, just for everybody to know, you can prevent puppies by doing an ovary sparing spay, where you take out the uterus, can't make puppies, and with the males, you do a vasectomy, basically. And so you're preserving the hormones, and they will go into heat, and they will have male dogs chasing them, but they can't make puppies. And so therefore you don't have to worry about, I totally agree, Joan, that we need to have that relationship, but I just want to let everybody know there are ways to not have the puppies.
And people need to be able to make choices, but they need to know what the consequences of their choices are. And I think that's my thing. There are a lot of people who they're not going to do an ovary sparing spay. They're going to do a routine spay. If they didn't do that, they'd be cranking out 23 puppies a year. And we all see the problems with that. But I think owners need to really be educated. And this is one of the most common questions we're asking in our practice now is do you recommend spaying and neutering? It's legally mandated at this early age by the city for good reason, but it's not good scientific policy at all.
No.
Whoa, you're saying in LA it's mandated by the city?
It's mandated. It's mandated via a couple of different things. First of all, you have to have a breeding license to have an intact male or female dog, and the cost of the breeding license is considerably more. And now they've just announced that they're not going to allow the issuance of those breeding licenses, which is not mandating spaying, but saying you have no choice but to get your dog spayed because we're not going to give you the breeding license.
Say that
So,
word.
Wow.
Yeah.
Wow.
I live a county over, and that's not the policy here, as far as I know. You're telling me in LA you can't have an unsterilized dog?
You can, but you have to license it as a breeding permitted dog.
Man, that's different than 30 miles south where I'm at.
Yeah, no, it's and the intent is our shelters and our animal care givers, our rescuers are overflowing. There's thousands of animals coming in and no place to put them, and so the desperation of the politicians is to try and make policy that promotes spaying and neutering, but they're not consulting people. And in fact, I don't think that a lot of people actually even want it known, this information that we're talking about. What's the organization, Ruth? The International
Erasmus Foundation.
No, the International Veterinary Community. They just came out with a study.
WSAVA.
Yeah. They just came out with those. You talk about it because you know the material. But they just came out with a recommendation that spaying is no longer considered to be a routine procedure. It should be considered as an individual surgery and discussed. This is now official
and only
policy
is medically
of the World
necessary.
Organization. Yeah, they're not a group of collective fairy worshipers. They're literally
then I'm out.
Hardcore evidence-based people.
Well, the interesting thing is that in every other country except for the U.S., there is something called supralorin, which is a gonadotropin releasing hormone inhibitor. And the reason I'm saying all these big ugly words is that if you give this as a pellet to an intact animal, it inhibits them from being able to reproduce. So they get to keep the ovaries and testicles, but they are not fertile. But in the US, it is licensed only for ferrets. There are some veterinarians that if you speak kindly with them, they may consider using it for your dog or as an off-label use, but it's difficult.
And now living on a farm, I have a lot of mice, and I used to joke that I needed spay-neuter cheese, which was spay and neuter cheese for them.
Yes.
Dr. Ruth, I have a question from Sarah in Las Vegas. And Sarah is a pet wellness advocate. She's a friend of mine, but she actually is a graduate from your courses. And I told her you were going to be on today. And she's part of your ongoing, conversations and groups. And she said to me, one of the things that worries her is that about 99% of all Prozac users are now animals. Dogs are prescribed Prozac at an alarming rate. And I'm just wondering about the correlation between that level of anxiety that could very well be food related or diet related. And if anxiety could be, systemically mitigated just from your pet croc diet.
So there's a couple of ways to look at it. One is, again, sadly, that's where receptors for luteinizing hormone are. The other thing is if the pet has allergies, and their histamine levels are high, and the histamine crosses the blood-brain barrier, that'll make you feel pretty weird and
Mm.
anxious. So I think it's multifactorial in terms of what's causing this massive escalation. Uh, but again, we have to scale it back to the basic things that we know that will help return this animal to health. So you could add in the glyphosate, the heavy metals, the molds, the everything else, the whole laundry list of stuff to worry about. But if we don't have some sort of program in place to support the microbiome, to support homeostasis and health, then we get into trouble.
Is there a like a hot list, or like as a pet guardian, what would I go to first, like the number one culprit to really decipher that?
The number one easiest thing to access is changing the food to something that's real. And
Mm.
I'm sort of alone with many of my colleagues in that I do advocate for home cooked food, because I was trained in traditional Chinese medicine versus raw. I think real food, whatever your bent is, you're going to be miles ahead of any highly processed kibble.
There's a good study now from the European researchers that actually shows that puppies that are fed raw, and I'm not a raw advocate either. I'm a cooked food advocate. But there is a good study that contrasts commercial dog food to raw food, and those raw fed puppies have fewer allergies. That's a scientific fact based on the findings of that study. And since allergies are one of the number one reason why people go to the veterinarian, along with gastrointestinal disease, that recommendation to feed whole food is pretty powerful.
Mm.
Yeah.
It is. I mean, that's that's been the basic tool that we have ever had through most of our history. And then we now have frankenfoods that are creating problems for us, for our dogs, for our cats, for horses, for all of us that are eating this processed stuff.
But there's a lot of people that can't afford to do the way that, you and I would do. So then what's a way that people could start to supplement the food that they believe is good?
Right on. So the easiest thing is to, if you're a member of one of the wholesale clubs, go in and get a giant bag of frozen Normandy blend vegetables. So that's broccoli, cauliflower, zucchini, yellow squash. Take a handful, throw it in a pot of boiling water, let it cook fairly well, and then pour the whole thing over the top of the kibble. So there's optimal, and then there's what you can do. And I think there's always a small step everyone can take towards fresh food.
And even maybe eggs or things like with
Real food, yeah. Whatever, we used to, eggs, leftover meat from family dinner, whatever you've got there that will help improve what's in the bowl.
And so that's doing that, changing, just making that simple change is decreasing the amount of advanced glycation end products that come from highly processed foods. And we now have research that shows that not only dry food is high in these, but actually canned foods were actually higher than some of the dry
Higher.
food. And so
Yes.
crock-potted foods cooked at a low temperature for a longer period of time are going to have less of these advanced glycation end products that literally create food allergy and leaky gut that then leads to sensitivities that make you more likely to become allergic in other subjects. So we're always back to harping on this whole food issue and just changing the food. Ruth, can you talk about on the food issue aspect of allergy management, how the food actually permits detoxification without herbs, without homeopathics, without weird fasting or any of that kind of stuff, how just the food itself affects the liver and the toxic levels that accumulate that then make the immune system go wacky?
Well, there's a couple of things. So if we're adding a fair amount of vegetables in the diet, the fiber itself helps to pull stuff through the gut and out. And then, we've been hearing, eat the rainbow for 20 years now. Well, it turns out the rainbow isn't for us. It's for the microbes. It's for the good guys in our gut. And so if we feed all of these colors, the colors are polyphenols. And the polyphenols are what encourage a healthy balanced microbiome to grow. And when that happens, then the gut can take on detoxification processes both for the kidney and the liver. And in doing that, then the liver is better able to reduce its workload and really get rid of some of the backlog.
Yeah, and histamine is actually a liver toxin. Like, people don't realize that when you have an allergy and you're making histamine, literally every day you're itching, you're poisoning your liver. So if you start out with a weak liver and then get allergies, you need liver detoxification. And honestly, the best way to do that is with gentle herbs, things like dandelion and fasting, and proper diets that aren't highly processed and full of microplastics and all that.
Yeah.
So
And I think histamine is a whole body toxin. I mean, we know it goes in the brain. We know it can irritate the stomach. We know it can irritate the joints and skin and everything else. So it's a gnarly thing to deal with. Sorry, and I'm gonna cut you.
Yeah, actually, I really want to encourage people and have you say more about this. When Joan said, the cost, really feeding a total fresh food diet is less expensive there are lots of ways to have it be less expensive. So can you go into some of the ways? Because I bet ones I don't know. I always recommend finding the slaughterhouses for wild game for the hunters and looking for products that are about ready to go out of date. So what are some other ways that you can get the meat and protein sources that it's cheaper than feeding good kibble? I mean, certainly cheap kibble you can't beat, but
well, and so this is the difficulty, right? Because food prices are so astronomically high everywhere. And so if you're trying to feed your whole family more whole foods, then this is where you do need to start shopping carefully. So again, the big food warehouses, those can be super helpful, watching for sales. If you've got a local butcher that you can, say, hey, can you, save the grindings for me so I can work this into pet food, they're often very happy to do that because much of that they would have to throw away. And then if you've got, friends that hunt, maybe they've got an extra deer you could use for your dog or something like this. So you have to really get creative. But I think that that's the case for the entire family. Same thing with produce. If you just are very cognizant about using the environmental working groups, clean 15 and dirty dozen, avoiding the dirty dozen.
Now say what you mean by that. Not everyone knows that.
So the dirty dozen are the fruits and vegetables that are most highly contaminated with glyphosate, herbicides, pesticides, and all the other yucky stuff.
So those are the ones you want to buy organic, but all the others you don't have to buy organic. And so that's the way that you can save money. And others,
exactly.
Just be super creative and you will find, lower price things out there for your animals. Because dogs, how about eating, the food that's just getting close in your fridge? Dogs can handle that, right?
Exactly. So anything that looked a little suspicious or was starting to go south in our refrigerator, we had a big bag we'd throw it all into in the freezer. And at the end of when it was at the end of the month, when it was time for us to cook up again, we would use that bag first and go through it. But I think, what you started to say too is that what many people would do is they'll start small and they'll start to see huge changes in their dogs, how they're feeling, how their itch is going away, the stool's getting better, all of this. And they realize they don't have to go to the doctor so often. So it becomes more cost effective to actually feed whole food.
Excellent.
We routinely see people make that change within 6 weeks by just telling them to do one thing, just stop feeding the dry food. And then they'll switch to canned. And then they'll see within 6 weeks, their dogs are more vital, they're more active, they're itching less, they don't stink as much. And that opens them to the whole thing. Ruth, how often do you see the dog precede the owner on a healthy track of lifestyle changes.
Yeah, I mean, and that's it. The dog has no placebo effect. And so, most of us are like, I just cannot give up my Doritos, but the dog is telling you that how much better it will be when you do give up the
Yeah.
Doritos.
So really the holistic change, I mean, it's a global change that takes place if you improve the elements of one area. So if you're eating a lot of sugary drinks yourself and you just say, well, I'm not going to drink those sugary drinks, I'm going to drink something that's healthier like water and some other things, and make that one change. And then, I've had literally one client in particular was making six figures who started getting crippling migraine headaches. And when her husband came into the office for a rabies vaccination, ironically, he told me about what's going on. And I said, can I just ask one question? And he said, what? I said, like, how often does she drink soda with artificial sweetener in it? And he said, that has something to do with migraines? I said, well, it can. And they both drank like 4 to 6 cans a day of an aspartame containing artificial sweetened soda. And they both just decided, well, if you're going to go off, I'm going to go off, because otherwise I'll be tempting you. So they both stopped. And in 8 weeks, her migraines were gone. And in 12 weeks, she was back to work making her good figure and stuff. And then you ask yourself, what's the cost of these choices that we make for ourselves and our animals? And I mean, that was a 6-figure lost. Yeah.
Wow.
Plus the cost of drinking the chemical, plus having to pay for the thing that's poisonous in the first place for you.
Dr. Ruth, I'd like to ask again, as a pet guardian, obviously what we feed our pets is in our control. How about environmental factors? What, as a pet guardian, can we look out for that's maybe number 2 on that list, or super important as a pet guardian? What things in our environment can we control in that situation is related to allergies?
And I think really one of the most important things, and this will not make sense intuitively, but it's water. If you're not using some sort of a water filter to pull out at least chlorine, but preferably something that will pull out the heavy metals, the cysts, the glyphosate, the herbicides, the pesticides, the PFASs, all of those yucky things. By doing that, it's kind of like, to get to the point where there's enough stuff going on for the pet to itch, if we can sort of lower the baseline by pulling out those chemicals, I think we'll make a huge impact. And then the other thing is to be very cognizant. If they're going outside, clean their feet off. If they're licking themselves, grooming themselves, and you've been out and there's pollen everywhere, then wipe them down with a damp washcloth or something like this. So there's a lot you can do in terms of just being mindful about what's in the environment.
I appreciate that. I noticed the cats make a beeline when I drink a fresh glass of water in the morning, and that's all they want. They want to drink my water. So
Yes.
They reminded me of that. They know I've got the good stuff.
Yeah. You share it with them. That's what they're like. They're after.
So I have a question about the wiping the animals down. We had Ed Begley Jr. on our show talking about sustainability, and he has a product that's a dry shampoo that I know Joan has used very successfully, and you just sprinkle it on and brush them off. Joan doesn't even have time to brush them off, and I'm wondering if that would take the environmental toxins off when they've been outside. What do you think?
I'm not sure, to be honest. I mean, theoretically, it should.
Yeah.
But this is something quick and simple and easy too. Just get them.
My dogs roll in the most
right, and of course, flea and tick. How about flea and tick toxins?
You mean the pesticides and all of that? That's kind of it. You have to really look at, where do you live? What's the actual incidence rate of flea and ticks? And then what can you do with essential oils, Baltic amber collars? There's just a myriad of other options in terms of reducing your pet's exposure to flea and ticks.
Absolutely. Now, we've talked a lot about prevention, and even even moved into curing, which is when they have an allergy, when you switch to fresh food, that may eliminate it. It may decrease the symptoms and completely eliminate the problem. What about those clients that I've had where they've already done the food, they're already doing a clean environment, clean water? What are some of the other strategies in terms of treating skin and digestive symptoms from, quote, allergies? It's not really an allergy doing it, right? It's an allergy triggering that underlying energy field imbalance. How do you address that?
There's a couple of ways we go about it. Even if they've done some food changes, I often suggest and have trained my coaches to use a food sensitivity test to see what is bugging this dog or cat that they're eating. And then from there, remove those foods and then create something called a rotation and elimination diet. Meaning what they're going to do is set up 3 different recipes so that every 24 hours that dog or cat is eating something completely different. And then we'll use things like quercetin and stinging nettles, Chinese herbals like Lang Dan Jie Gan is a great one for itchies, to help kind of cool things down, and then continue to support the gut with probiotics, fermented foods, all sorts of things to really get the gut to calm down first. And then often we'll start to see the skin calm down quickly. Because if you think about it, what's lining the intestines are in epithelial cells, and what's on the skin are epithelial cells. So if there's issues going on in the gut, the body's reacting to what's going on with the intestinal epithelial cells and then transmutes that over to the skin, if you will.
Literally transports it. A lot of these things are actually transported through the extracellular matrix, that sort of gel between the cells. And as much as some people are annoyed by talking about meridians and fascial planes because they're invisible, we have now very good science that shows that they transmit photons, and they also can change to local, in response to local changes. These glycans that look like big ostrich feathers, they just form virtual tubules that transport material that's water soluble or fat soluble from one place to another without there even being a road there. They make their own road. The body's way more intelligent than we realize. And herbs affect that whole area. A lot of different things do. Can you talk about some of the other herbal therapies that you use? Maybe talk about like a general seasonal detoxification that you could use, or talk about how we can change those herbals that we prescribe, not based on the actual symptom diagnosis, but more about the pattern diagnosis. And that's being one of the strengths of Chinese medicine. I'd love to hear your thoughts on that for our viewers.
Exactly. And there is sort of the cookbook approach, use this for that. But if you're able to work with a veterinarian who is trained in traditional Chinese medicine, then they're going to use some additional tools like tongue and pulse diagnosis. And then the overall demeanor of your pet, the experiences they've had in their life, to really formulate, okay, what is the total disharmony going on here? What is the total pattern of disharmony? And then make some better choices in terms of using herbs that may cool the symptoms down, but also more importantly, support the organs that are either in excess or in deficiency, so that they are, again, the goal is to create homeostasis with the
And
herbs,
when we
with
use,
the diagnosis.
yeah, and when we use foods and we change the terrain, the environment of the body, then the herbs that we use to prescribe should change also. If we're just doing stimulus response sort of prescribing with herbs, that's one level. And Dr. Shea, he's one of the top Chinese herbalist instructors here in the United States. And he just always says, many people use herbs, but there are few herbalists, And so that's that we need more herbalists, more people who have extended training to help teach all of us better ways to do that. So thanks for your work on that.
Also, I want to bring up 2 little things. What would be the benefit of, I always think about, like, if I'm giving one supplement all the time, is it still effective? And then the other question is, what do you think about feeding seasonally? Like in Chinese medicine, for example, I don't eat salads in the winter, or, like, how do you do that with the dog and cat food?
So there's a couple of, so in terms of should you use one supplement all the time, and those are amazing questions, Joan. I think that what happens is we see so many clients come to us and they've got this dog on 17 supplements and they have no idea what helped, what didn't help. And so I think that's one of the first thing that I like to do, and that I've trained the coaches to do, is if they're on 17 supplements, stop everything if they're not sure what's going on. And I think they need a break periodically. And then in terms of feeding seasonally, once they get past that rotation and elimination diet phase, then that's an amazing thing to do. But it's really difficult for most people to even know what should be in season in their region. And you're right. I mean, we should not be eating bell peppers and eggplants in January. But because stuff is shipped all over the world, that's kind of what, well, I'll just have this week.
Well, we've run out of time. Dr. Ruth, it's been an amazing conversation. Thank you so much for being here.
It is such a pleasure, Anna. Thank you.
Thank you. And I know our panel had a great time, and thank you to them as well. Dr. Ruth, how can our audience stay in touch with you and maybe find out more about the Crock-Pot diet?
It's super easy. You just go to drruthroberts.com, and from there you can look for the original Crock-Pot diet, and we've got tons of blogs. I've got a very extensive YouTube channel as well with probably 500 videos. So there's a lot of stuff out there that folks can help support their pets with.
Thank you. That's perfect. Really, really appreciate this conversation. And if you at home would like to be a part of it, you can email us your questions to our website. Thank you again, Dr. Ruth, for helping us raise our animal IQ and giving us great ways to enrich their lives. So here's a final quote for all the dog lovers. No matter how little money or how few possessions you own, having a dog makes you rich. We'll see you again next time. Thanks for joining us. Until then, love your pets. Medical information obtained from our website or the live show is not intended to be a substitute for professional care. If your pet has or you suspect they might have an illness or other medical condition, you should consult a healthcare provider. The opinions expressed on this TV program are not necessarily those of Smart Pet Talk, this TV show, or their sponsors. For all questions or info on sponsorship, email us at info@smartpettalk.com or visit our website at smartpettalk.com.